Our lecture today هي آخر lecture, the last two lectures for this year هي potentially malignant disorders وبعدين oral epithelial dysplasia. They are closely related to each other. Chapter 19 potentially malignant disorders before كانوا يسموها pre-malignant lesions ولحد الآن كنا يسموها pre-malignant. Why did they change this terminology from pre-malignant to potentially malignant؟ لأن شافوا خلال الإحصائيات إنه not all these lesions become malignant. Some are benign, some are normal types of, يعني it's pathology but it's not related to malignancy or neoplasia. That's why the terminology changed to potentially malignant disorders. We have various mucosal lesions in the oral cavity. Some could be normal, some could be squamous cell carcinoma اللي هي the most dangerous. These lesions are usually red or white in color. A risk for development to cancer vary quite differently. يعني I have red lesions, I have white lesions. The most, if I make a comparison between the red and white, the red is more dangerous. I have red and white, I have speckled, يعني a mixture of red and white. So الred يسموه erythroplakia, الwhite they call it leukoplakia من leukocyte, leuko white وplakia patch و erythroleukoplakia هي اندماج red and white. Which one is more suspicious؟ هو الred. Why؟ هي الإحصائيات هي اللي تحكي. احتمال يقولون because it's more يعني يعني exposed to the oral environment than the white lesion. We will explain during this lecture about the difference between the white and red lesions. Number 3, slide number 3. Terminology. As we said, we have oral potentially malignant disorders. It used to be say pre-malignant or pre-cancerous. Why they changed? Because pre-malignant معناتها it should become malignant, but this is not true. Is there a difference between pre-malignant lesion and pre-malignant disease? Yes, there is a difference. Included pre-malignant lesion, it's a lesion that will become pre-malignant, whereas elsewhere in the mouth it's called a pre-malignant disease. Slide number 4. As we said, we have red lesions and white lesions. نرجع مرة على الجينيتك فيلد اللي يسموها human genome map اللي هي هاي اللي حكينا عليها بالسيست. There is something called human genome map اللي هي علماء in the USA قدروا يفكون الشفرة مال الhuman genome map, and it is very important to include this type of science in the field of disease, because there is a huge relationship between genetics and many types of disease, خاصة اللي لها علاقة بالcancers. Many disease, even sickle cell anemia, a lot of diseases اللي هي نعتبر نقول وراثية أو شيء, it's related to the human genome map, الخريطة الوراثية للإنسان. it's now يعني اكو كان بروجكت والحمد لله شفروها كلها هسه هي واضحه, الهيومن جينوم ماب to the scientist. نجي الريثروبليكيا والليوكوبليكيا. الريثرو قلنا الريد والليوكوبليكيا الوايت. why is the احتمال يجي السؤال, or you can ask yourself, why is this white and why is this red? The erythroplakia are red because mostly the underlying blood vessels اللي هي capillary وال arteries والveins are يعني could be seen to the naked eye. بما معناته إنه ال epithelial lining has been removed. That's why it's easy to see the underlying red tissue. Also, it could be inflamed. When we see inflammation, we see a red lesion. So these are the two causes in we see a red erythroplakia. In leukoplakia, white lesion, there are two main causes. One, it's related to hyperkeratinization with moisture. يعني hyperkeratinization alone is not leukoplakia. Hyperkeratinization with moisture is leukoplakia. والدليل انه نحن كلتنا عندنا hyperkeratinization مثلا باسفل الفيت مال our feet. So it's not wet. When bodies become wet, when it, we go مثلا when we see children swimming in a swimming pool, you see the keratinized area becomes white because it's filled with water. وعندنا تعرفون شغله الريفراكتيف اندكس هو معامل انكسار اللي يحول this lesion it becomes white. الاورال cavity is always moisture. دائما ال digestive system من الاورال cavity until the end, it's all of moisture. That's why it's white, but the oral cavity is accessible. That's why it could be seen. The esophagus and other stomach, يعني other types of leukoplakia could not be seen unless we have شغلة الناظور أو الأشياء. But the oral cavity is accessible. That's why you can see white lesions, you can see red lesions, you can see yellow lesions, you can see gray lesions. There are many types of lesions, many types of color, but these are because of potentially malignant lesions. We will study them closely. Slide number 5. This is a clinical feature of erythroplakia. You can see it's on the lateral and ventral surface. Ventral هو the upper والdorsal surface it's toward the floor of the mouth, and it's يعني related a little bit to the يعني شوية toward the soft palate. The patient is an old patient, he is a smoker. This lesion should be very suspicious. The lateral border of the tongue, it's a dangerous location. You should take suspicious. You should take it in consideration. Red lesion is suspicious. Patient is smoker. These all multifactorial causes that lead to, and we can consider it as a pre-malignant or a potentially malignant lesion. Slide number 6.